First class requirement number 8, Part B.
Demonstrate bandages for a sprained ankle,
And for injuries on the head
the upper arm,
and the collarbone.
Having the skills to apply the right bandage at the right time can save someone a lot of pain and agony. And it might even save a life. That can be especially true with head injuries because a cut to the head can cause severe bleeding. So call for help immediately. If the victim is bleeding but conscious, have them apply pressure to the wound with a clean cloth and keep them comfortable while you wait for help. If the injury requires the entire scalp to be covered, use a triangular bandage to wrap and cover the scalp as shown here. While less serious, an ankle injury can be very painful, even disabling. An ankle sprain happens when you bend your foot far enough to strain the tendons and ligaments inside. If you do sprain your ankle on a hike and must keep walking, do not, I repeat, do not remove your boot or shoe. The injury could swell, and you might not be able to get your shoe back on. The best way to bandage that ankle is to reinforce it, shoe and all. Use a triangular bandage or strip of cloth. Wrap the bandage under the boot, around the ankle, back through the sides of the bandage, and tie it off in the front. This reinforces the ankle and reduces further strain on the tendons and ligaments. As soon as you can, stop walking. Take off your shoe and rest with your leg elevated. An ice pack or cold towels can help reduce swelling. Get medical care as soon as you can. For treating injuries to arms or legs, you may need to use a splint. A splint is any stiff material that can be bound to a fractured arm or leg to prevent the broken bone from moving and causing further injury. An effective splint can be made from a branch, ski poles, folded newspapers, whatever's available. For an upper arm fracture, you can tie a splint to the outside of the upper arm. You may want to pad the splint with something soft like a towel or crumpled paper. When the splint is secure, place the arm in a sling with the forearm raised about 3 inches above level. Then use a cravat bandage to hold the upper arm against the side of the body. That way the body itself acts as a splint to immobilize the elbow and shoulder. For a collarbone or shoulder fracture, a splint is not appropriate. Place the forearm in a sling with the hand raised higher than the elbow. Then tie the upper arm against the side of the body with a wide cravat bandage to immobilize the arm and shoulder. Be sure to check your Boy Scout handbook for illustrated first aid instructions on these and other injuries.
That's first class requirement 8B.
Demonstrate bandages for head
Upper arm
and collarbone injuries.